Chapter 1. Hospital Pharmacy. Hospital is a complex organization. It provides healthcare services with the help of trained, well-educated staffs and special scientific equipments. Hospital Pharmacy. Hospital pharmacy is a healthcare service provider in which medicine storing, compounding, dispensing are performed and medical devices and advices are provided to patients with safe and effective manner. Scope of hospital pharmacy. 1. It inspects, the medical items are received and maintains an inventory record. 2. It dispenses drugs and other pharmaceutical products to patients. 3. It has a record of each dispensed medicine. 4. It has a record of narcotic and alcoholic drugs received and issued. 5. It manufactures the drugs in case of shortage and drugs available in high cost. 6. It helps in minimizing the illness and promotes the health. 7. It provides drug-related information to the healthcare team and patients. 8. It helps in quality control of drugs. National and international scenario of hospital pharmacy. 1. The pharmacists are the third largest group of healthcare professional in the world, and along the growth of pharmacists, the hospital pharmacy is also growing steady. 2. The main job of pharmacist is to manufacture and dispense the drugs, but this role is evolved now and they are playing an important role in the care of patients. 3. Many of countries are not accepting the pharmacists as healthcare team, although they are capable to work in this field. 4. In India, a hospital pharmacist has a limited role in comparison to Western countries. 5. Many of countries granted the pharmacists to prescribe drugs for patients. 6. Hospital pharmacy is an important part of hospitals to provide pharmaceutical preparations. 7. Developed countries have clearly defined the role of hospital pharmacist, but many of countries have not defined their roles. Organizational structure of hospital pharmacy. Administrator. Chief Pharmacist. OPD Emergency. Secretary. Pharmacy staff. Pharmacy students. Clerks. Works and qualifications. Dispensing quality cont. Storage manufacturing clerk. Clinical trail. D. Pharm. M. Pharma. B and D. Pharma. M. Pharma. D. Pharm. B. Pharma. Professional responsibilities of a hospital pharmacist. 1. To follow the hospital's policies and covey other for that. 2. To maintain accuracy of dosage or prescribed. 3. To provide drug information and way of administration to new staff or of new drugs to all staffs. 4. To remain updated about new drugs, effect, side effect, etc. 5. To give instructions to the patients for self-administered drugs. 6. To take parts in new research and development. 7. To educate and make trained the pharmacists and pharmacy students are taking practical training. Qualifications and experience required for a hospital pharmacist. The chief pharmacist must have minimum postgraduate degree in pharmacy, especially in pharmacology or hospital pharmacy. Manufacturing chemist should have graduate degree in pharmacy with minimum 18-month experience in drug manufacturing. Dispensing pharmacist should have minimum diploma in pharmacy. Ph.D. degree holder is preferred in all categories. A chief pharmacist must have these qualities. 1. Administrative and management ability. A pharmacist should have the ability of planning, implementing the pharmacy policies and ability of making budget, stock control. B. She should have ability to interview and select staff for pharmacies. C. She should have ability to manage staffs and distribute works between them. 2. Manufacturing ability. He should be able to manufacture drug in case of shortage or high cost of drugs than normal. 3. Knowledge. She must have complete knowledge about drug action, side effect, routes of administration, and quality control. 4. Research ability. He should have ability to research and develop new drugs. 5. Teaching ability. He should have ability to give lecture to the nursing staff and students are under training. Job specifications for a hospital pharmacist. A job specification is the list of recommended qualities for a person to qualify a position. A pharmacist should have the quality and experiences in dispensing drug, performing quality check, formulating and reformulating dosage form, monitoring and reporting drug safety, creating medications budgets, storing medication and in planning of drug qualities for hospital. Workload requirement for a hospital pharmacist. Workload means how much work can a person do in a specific time. The workload of pharmacist is observed analyzed by work characteristic. Some characteristics are following. 1. Working hours per week. 2. Numbers of hours that a person spent working alone in his or her department. 3. Numbers of prescription filled by a pharmacist daily. The number of pharmacists needed for a hospital is determined using the number of beds. Up to 50 beds, 3 pharmacists. Up to 100 beds, 5 pharmacists. Up to 200 beds, 8 pharmacists. Up to 300 beds, 10 pharmacists. Up to 500 beds, 15 pharmacists. They may be increased and reduced as required. Interprofessional relationships of a hospital pharmacist. The relationship between 2 or more professionals is called interprofessional relationship. To get good result, it is necessary to maintain positive relationship between various professionals, as doctor prescribed drugs, pharmacist dispenses, and nurses give to patients. Good pharmacy practice in hospital. It is a pharmacy practice that responds to the need of people who use the pharmacist's services to provide them optimal, best, and evidence-based care at standard level. Requirements of good pharmacy practice. The main important part of pharmacy activity to help patients through the supply of medicines and healthcare products. The provision of appropriate information and advices to the patients. The administration of medicines. Roles of pharmacists in good pharmacy practice. Roles of pharmacists in GPP are to prepare, obtain, secure, distribute, administer, dispense and dispose of medical products at the standard level. Hospital pharmacy standards. Standards of good pharmacy practice in hospitals. 1. FIP, International Pharmaceutical Federation, Basel Statements. FIP is a global organization that represent and assist pharmacy, pharmaceutical science, and pharmaceutical education worldwide. In 2008, a conference was conducted in Basel, Switzerland by FIP, which included hospital pharmacists from all over the world and discussed about the future of hospital pharmacy. FIP Basel Statement. 1. Procurement. 2. Influence on prescribing, doctor's choice, cost, marketing influence the prescription. 3. Preparation and delivery of medicines. 4. Administration of medicine. 5. Monitoring of medicine use. 6. Human resources, training and development. 2. ASHP, American Society of Health System Pharmacy. The American Society of Health System Pharmacists represent all pharmacists who provide health care service. This organization is made up of more than 60,000 members, including pharmacy technicians, pharmacists in training and professional pharmacists. Minimum standards required. 1. The pharmacist should have appropriate knowledge of pharmacy department. 2. Knowledge of abbreviation. 3. Knowledge of dosage calculation. 4. Knowledge of procurement and inventory. 5. Knowledge of administration. 6. Knowledge of production, packaging and labeling. NQAS National Quality Assurance Standards Guidelines. Introduction. NQAS is an organization. It was made up by Ministry of Health and Family Welfare to highlight top performing facilities and to increase the trust of people on public hospitals. Organizational structure. NQAC SQAC DQAC. Some area where they focus. 1. Service provision, patient right, infection control, quality management. 2. Hand washing facilities. 3. Postpartum care, hormonal level and uterus size return to a non-pregnant state after 6 weeks of childbirth. 4. Oxytocin administration within 60 seconds of childbirth. 5. Availability of curtains, etc. NABH National Accreditation Board for Hospitals and Healthcare Provider Accreditation. NABH is a constituent part of Quality Council of India QCI. It is made up to operate hospital accreditation approval program for healthcare organizations. This board give approval to hospitals and healthcare providers after completing certain standards criteria. NABH standards for hospital pharmacy. 1. Legal requirements. A qualified pharmacist should have their certificate displayed in the pharmacy. B. Schedule H and X drugs should only be sold by retailer, when they prescribed by a licensed medical professional. C. The pharmacy should not sold the physician samples. D. The NDPS medications should be kept in locked container and a register should be available to keep record of every issue of NDPS medications. E. All the legal documents should be updated during valid time. 2. Access to medications. The pharmacy should stock only those medicines which are listed on the hospital's formulary list of medicines. B. The pharmacy in charge should be aware of the procedure for obtaining medications. C. The room and area where the medications are kept should be clean and free from vermin and bugs. D. The proper security like CCTV and entry restrictions should be available in pharmacy. 3. Medicine safety. A refrigerator should be available for the drugs are not stable in room temperature. B. Personal items like food drinks should not be kept in the refrigerator as used for drugs. C. Lots of drugs should be stored separately or color coded. D. A list of high-risk drugs should be identified and made easy available. 4. Other safety. A fire safety like fire extinguisher should be available.